I realized that there was this whole wide world outside of my tiny circle where not everybody thought the way that I did. And these were the people that needed a scientific voice, not even a physician, anybody that sort of kind of knew what they were talking about, that could not just explain things to them, but break it down in a way that everybody could understand.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. So this one is a special one, a unique one, because it's with someone who I consider one of my mentees. Obviously he's a colleague now because he's going to be starting his interventional cardiology fellowship at NYU come this summer, so the summer of 2022. But I've known Dr. Panwar when he was a resident. I can say I knew him then at Case Western is when we crossed paths, and then he went south for his cardiovascular disease fellowship at Tulane. So he's going to finish that in June this year, and then start his interventional fellowship at NYU. So Siyab and I have known each other for several years. We've published research and science, when we crossed paths at Case Western, and have sort of stayed in touch since. And I came across a recent post from Siyab on Instagram because we follow each other on Instagram, and I was reading through it, and he was vividly describing how he utilized a new social media platform. Now, pardon, I'm not on that platform because, maybe I'm too old, or maybe maybe I don't want to be on too many social media platforms. But it's TikTok. It's a very popular social media platform, and because of Siyab's interest in public health, and he's also done research at the intersection of cardiology and public health. We've published on flu vaccines and heart failure in one of the leading cardiology journals. Siyab got interested in debunking misinformation on COVID-19 and vaccines, and has sort of created a following for himself, and has been a voice on TikTok, and has also become a voice on Instagram, if I may. So with that introduction, Siyab, welcome on the show, and thank you so much for doing this for us.
Thank you, Ankur. Thank you very much for having me. It's an honor. And, as you said, we go way back. We've known each other for 5-6 years now. And, you've been instrumental in me getting where I am, and also, me having an interventional cardiology career. So I have you to thank for a lot of that. I'm happy to, I'm glad you reached out. And again, I'm honored to be on the podcast and talk about what I've done.
Yeah, no, excellent. So I think it's important for physicians and doctors to have a social media presence. I've written about it, for one of the social media platforms, which for one reason or another has garnered traction with academic cardiologists, and that is Twitter. Not to say there are many other social media platforms, including TikTok, and TikTok being one of the newer social media platforms is a video-based format. Do you want to talk to us a little bit about the platform? Because, certainly I'm not on it, and I don't know how many cardiologists are on it, but why don't you talk to us a little bit more about what TikTok is all about?
Yeah, I'm happy to. So TikTok, I got on TikTok a year ago, but it has actually existed for at least a few years. And from what I'm looking right now, there has been at least a couple billion downloads of the app worldwide. So since it was released, it quickly became a phenomenon, especially during the pandemic. What it basically, at the very, what it really is just a video-based social media app. And what people do is people make videos anywhere from 10 seconds, 15 seconds, 30 seconds, a minute, 3 minutes now, and 10 minutes coming soon. and basically put them on their profile. So it's kind of like Instagram. It's a post to their profile, and then it gets pushed out to the community. People, there's something called the For You page, which is the general where everybody on TikTok that has a profile has a For You page. Scrolling through TikTok videos, it kind of gets a sense of what you're interested in. And those videos start showing up on your For You page as well, even if you're not actually following the person that made it. And sometimes, videos get pushed out if they're doing extremely well, they're popular, viral, etc. And the videos get a lot of views. Anybody can make an account, make a video about anything, and publish it for the world to see. And, you might get 100 views on your videos, you might get 200 views, you might get 1,000, and if you're lucky, you might get 5 million. That is one of the things that makes this app crazy, if I may.
Sure. So, no, this is, a very high-level introduction on what seems to be a fairly engaging app. The idea is it's a video-only app. So essentially, if you are going to post something, it's only going to be in video format. There are no pictures or words or.
So you can. So while the idea is video, what people do is put up a picture, a static picture, and add some music to it and have no video to it. So it's sort of 15 seconds of just a picture itself. So people can do that, and they do that. And one of the strengths of the platform actually is the editing is, and I can get into that. The editing is very powerful. So when you make a video, you can add a lot of text to it. You can time the text to, start at a certain time and end at a certain time. You can add stickers. You can add pictures. You can do so many things. It's a very versatile platform.
Understood. So it's sort of a medium for creation, right? It's creativity and videos, and it's powerful because it's audio and visual, and it's sort of for the world to see, however many are on the platform, and based on 2 billion is not a small number by any stretch of imagination. So how was your foray into TikTok? What sort of prompted you to be on the platform and sort of start making videos on COVID-19 and vaccines?
Yeah, no, that's a great question. So I started my TikTok about a year ago. I was already doing a little bit of education and debunking misinformation on Instagram and other social media, a little bit. But what drew me to TikTok, honestly, to be very honest with you, was about a year ago. I just needed a side hobby, and I'm sure you agree with, you can relate to this. When you do medicine and medicine is all you do, life can become very monotonous. And I think everybody should have something they're passionate about on the side that they can focus on and that brings them joy. So I just started my TikTok as a joke. Because, there was a lot of funny medical humor, doctors making funny medical videos, working in healthcare. And I was like, you know what, maybe I'll start doing the same thing. And I did. That's how I started, made a couple videos, just sort of generally talking about the experience. And they did fairly well. And then I distinctly remember this one day I landed on a video of somebody who was an anti-vaxxer. He was making fun of the COVID vaccine, and he was making fun of, the value of masking to reduce the spread of COVID. And that video had about 1 million views. I don't remember the exact number of views, and that had thousands of comments from people just agreeing with him. People saying, "Oh, the vaccines are useless. Their political agenda. Government agents are out to get us. The vaccines are poison. They're going to change your DNA, et cetera, et cetera." All the things that we've heard since the vaccines came out, and also about masking. They don't work. And I kind of, that made me realize that there is a whole world, or was a whole world, still is at the time, of misinformation and just plain disinformation, which is, lies and intentional spreading of misinformation. And especially on TikTok, it was and still continues to be a grave problem, because the power of TikTok is that anybody can make an account and anybody can start making videos, right? You don't have to be a fancy news producer. You don't have to have fancy editing tools. You don't have to put filters on stuff. None of that matters on TikTok. All you need to do is you got to have something you want to say, right? And all you do is open the app, put on the front-facing camera, hit the record button, and you record yourself saying whatever you want to for 30 seconds. No editing necessary, nothing. So that made it very, very popular for everybody to use because it's so easy, right? And it makes it so accessible. And that, I think, having a platform where it's easy to talk about things, I think also contributed to why misinformation spread so rapidly, because everybody had access to it, and people with ill intentions had access to the application as well. And all you have to do is make a video about how there's some conspiracy about the vaccine, and before you know it, your video has 1 million views, and 10,000 people are sharing it with their families and friends, and it just becomes a nightmare from there to deal with. And then I realized that, and I was like, that didn't make up my mind to get into debunking misinformation, but I started it. I was like, some of the stuff I saw was clearly wrong. Anybody that's had any basic science education, like you and I, it's clearly wrong. So I had some of that background knowledge, and to me, it just felt wrong that there was this level of misinformation existing there that was just allowed to go to spread rampant and without no countering. There were a few other physicians at the time that I'm now very good friends with that were debunking this information. But then I just started doing it. I just started talking about how, what this person is saying is wrong, and how, for example, the claim that the vaccine will change your DNA is wrong, or the claim that, the vaccine makes you magnetic is wrong. And it kind of blew up from there. And, before I knew it, I was making one video after another, and it just sort of snowballed from there. And so that was my start, Ankur.
Yeah, no, I mean, excellent. So, I think, well, first off, congratulations on the success. Do you mind sharing with the listenership how many followers you have on TikTok now?
Sure. Thank you, Ankur. So, before I say that, let me just say that all of this is just unprecedented. I was not expecting it. It just happened. I'm still shocked that I have had the level of success that I have. So let me actually pull up my application right now to share it with you. So as of right now on TikTok, I have 402,000 followers. So over 400,000 followers. I hit that over the weekend. And I have over 8 million likes on my videos since I started them across all videos.
Yeah. So, I mean, so that's incredible reach, and, congratulations for that. And, for someone who, obviously, thinks about, the reason why something sticks and why something becomes meaningful, right? Whether it's a manuscript, a paper you publish, or, a podcast you record, or, make TikTok videos. I think for anything to tick, or for anything to be of value, or for anything to connect to that many people of that magnitude, right? Or for anything to go quote unquote viral, it has to be impactful in ways which may be outside our comprehension, right? You could, it could be, for example, I'm gonna take a leaf from my own notebook because I think it's a good, it's a good allegory here. And that is, the research that we published when I was at the clinic on broken heart syndrome and COVID-19. And, when we were coming up with that project and that paper, none of us thought it would be quote unquote such a viral hit, if you may, because we've obviously published science which we feel as physicians and scientists is more important to move the field forward. But this was an observation which, we which we made during the pandemic, and we thought it was important to report. And just because of connection, the social connection, and the public health message that the project had, it became such a quote unquote viral hit. I tend not to use that terminology with science and with manuscripts and papers, but it was that kind of a paper. So I think it could be astonishing, and it could be shocking for you that you have this kind of following, and that's great. I mean, that many million views for all the videos is by no means a small feat. But what that tells me as an observer who's outside of the phenomena that you're experiencing and looking at it from outside, right, is that you've connected with the masses, and you share a message which is important for public health, and your videos have authenticity to them that people can relate to. It's just, to me, that's how I interpret your success. That it's authentic. It's coming from the right place in your heart. It's meant to educate, and it's meant to help people who are struggling to find out the right sources of information. And, I think voices like yourself who are learned, educated, know how science is conducted, have conducted science yourself. So, what I'm trying to get at is that voices like yourself on a platform like Tick-Tock are very important. And I think people would have resonated with your presence in the way that I've tried to explain it to you. Maybe you can add or delete however you may, but that's how I interpret.
Yeah, no, thank you, Ankur. When you mentioned your broken heart syndrome, your experience with that, that over the last year, this is something that I've realized over and over again. And I think it ties into what we do as physicians and our not only research, our daily practices. We might think that something is important, that something should be important to everybody else, just because it's important to us, and that might be true for a lot of things. But, sometimes you stumble upon something that actually matters to so many people, millions of people worldwide, is that your message about that specific thing that you may not even think is that relevant. It just blows up, and it reaches millions of people. That is what they're dealing with every single day, or that is what they're afraid of, right? So when you're talking about broken heart syndrome, you might have been surprised by the reaction that it got, that the response that it got from the general public. And what I've learned over the last year is that I can say why, and it's because it's something that is so relevant, right? It's related to COVID-19, first of all, which is already a very topical, relevant subject, which has been on the minds of everybody over the last 2 years. You're bringing in the heart into this, the cardiovascular system into this, and you're bringing in broken heart syndrome, Takotsubo cardiomyopathy. And a lot of people have had loved ones that have had not just heart attacks or heart disease, but also a lot of them have had Takotsubo. And just the name broken heart syndrome, I think that relates with a lot of people. And a lot of people are afraid. We know the effect COVID has on the cardiovascular system. A lot of people, millions of people in this country have either themselves or their loved ones, if they've been affected by COVID-19, they've been affected by the downstream secondary effects of COVID infection, including the heart. So, it's just something that is so relevant and so relatable to a lot of people. And I think that is one of the reasons why the response to your story was great. And it was very important. I think it was essential work that you did. And that sort of I've discovered as well in my time that I've been doing this is that, we live as physicians, a lot of us, at least the ones that don't have large social circles, we live in a very small bubble, right, of like-minded people. All of my friends, most of them, 90% of them are doctors, right? When it comes to basic public health things like vaccines, we all think the same, right? All of my doctor friends are vaccinated. A lot of my patients are vaccinated. But I'm sure that a lot of physicians will have the same story, right? They have a small group of people that are somewhat like-minded, at least in terms of thinking about science and public health. But what I realized in doing this was that the world outside our small circles is so large, and there are things that people will believe that you could just, that would blow your mind, right? The fact that people could actually think that, the vaccine would make you magnetic. Like the number of messages, I get a lot of messages, the number of messages that I've gotten, when this was a thing of a year ago that the vaccine was making people magnetic, a lot of people were asking me, can you debunk this? To a lot of other people who are not scientifically inclined or trained or public health trained, have not had the chance to do, scientific research. And you don't blame them. Not everybody's a scientist, right? So, for them to, here's the other thing I heard was that the vaccine will integrate into your DNA and change your DNA. The people that are challenging the dogma of, DNA becomes mRNA, becomes protein, right? And these are basic things to you and I. But there are people out there with malicious and malintent that take this information, they twist it, they change the facts to fit their own agenda, and then they spread it to people in their communities or on a wider scale on TikTok. And there are people that are influenced by that, and then unfortunately they fall for it, and they make the decision not to get vaccinated. So I realized that there was this whole wide world outside of my tiny circle where not everybody thought the way that I did, and these were the people that needed a scientific voice. Not even a physician, anybody that sort of kind of knew what they were talking about, that could not just explain things to them, but break it down in a way that everybody could understand. Because a lot of scientific, and I can go on about this for days, a lot of scientific communication that happens, I believe, does not happen in a way that benefits the end user, right, which is the patient or the person that we're trying to communicate to them, because we use terms that are too complicated, we don't explain things, we don't break it down. And I've learned a lot of valuable things in the process, in the time that I've been doing this, and one of them is, how do I break things down, break complicated scientific ideas? Like, how do I explain, what the spike protein on the vaccine, how that is different than the spike protein from the virus, right? How do I explain that to somebody in 1 minute? Because all I have is a minute, right? Because nobody has the attention span to read a 20-page paper or watch a 5-minute video. All you get is 1 minute. How do I explain that in a way that a 5-year-old could understand that, And that has been, it's been a realization that, if you're able to do that, people will understand and people will thank you for that. I get a lot of messages from people saying that, that they're so thankful that they have somebody that they can look to explain to them things, or to debunk all of the constant misinformation that comes out in a way that they can understand. And not just them, they can take it to their families. They can take it to their parents, their sisters, brothers, friends that unfortunately don't have anybody in their circle, that is willing to break it down to them and explain to them, why is this specific piece of misinformation wrong, or how does the vaccine work, or the dangers of COVID, for example. So sorry, that was long-winded, but I think the idea that a lot of it is relatable, and they're seeing somebody, I could be their doctor, somebody just talking. It's just like you and I having a conversation right now. So the way I look at TikTok is having a conversation with people, the person watching on the other end of the screen. So if you think about it, having a patient in your clinic, if you talk down to them, if you don't explain things, if you use complicated words, if you have an attitude that says, "Oh, I'm above you on some hierarchical level," that doesn't work very well. But if you're able to bring yourself down to their level and just have a conversation using regular everyday words, using analogies, I think that works very, very well. And the other thing I want to say before I end my point is, public trust in the CDC, the White House, the government has been very complicated over the last year, and a lot of it that has to do with the messaging that has come down from the top. Somebody is a random person, on the street, let's say, the likelihood that a message that is given out by the White House, the government, the CDC, because the likelihood that gets to them in a more effective way than somebody in their own community interpreting that message from the CDC and telling it to them, they're more likely, I believe, to believe the person in the community that is telling them what the White House said or what the CDC said, because it's the same thing. The CDC, the White House are these big ivory towers of public health, right? The common person doesn't have access to them, right? So what they do have access to is people on TikTok, people on Instagram, and that's what they see, right? And the information that is sent out by our public health agencies is filtered down on so many levels and changed on so many levels until it gets to the regular person. I see myself as an intermediary in that process.
I think it's important, right? Important for us as physicians to realize that, to have that understanding, to have that depth perception of the perceived hierarchy where, maybe subconsciously we put ourselves, or the public puts us, or our colleagues put us, right? Because we feed off of each other. And there's you probably know that I do a lot of spiritual reading and practice, and there's one thing that I've come to realize over the past, maybe I would say 4 or 5 years, and that is that you're not beneath anyone, but you're also not above anyone. And I think as immune as you should be to criticism, you should be very responsive to feedback. And if the public is telling you that, look, we're getting mixed messages, we have no trust in your healthcare system or in your public health ivory towers, and we really need someone we can rely on, someone who talks the language we understand, and someone who can break down complex topics to simple concepts that we can understand. I mean, Albert Einstein said that if you can't explain it in an easy way, you haven't understood it yourself. Then we ought to listen, because ultimately we are who we are, and we do what we do for our patients who are our beneficiaries, right? And I think if we can't do it effectively, then we may be talking X, Y, and Z, and breaking ground on the next big device or drug, which will change the trajectory of the natural disease for our patients. But if our patients are not taking them, what's the point, right? So no, extremely important message. Let me ask you this question, because I'm sure you may have been asked this question from the public, or from colleagues, or from your seniors, and that is, during a busy fellowship, how do you find time to create videos which are informative, engaging, and have gotten you 7, 8, 9, however many million views? And maybe your answer is you always find time for your passion, and that's a fantastic answer. But break it down into what were some of the housekeeping routine things you would do on a systemic fashion, so that you could create videos in the frequency that you wanted to create them. And the reason for me to ask this question is that if someone who wants to follow your path or your footsteps, what are some of the housekeeping rules you would share with them?
I'll start off by saying this. To me, this is still a hobby. It's something I do on the side. My primary job, my primary responsibility is my work as a physician, cardiology fellowship. Like, nothing comes above that. So everything that I do as a addition to that, right? So there are days that I don't put out any videos. I've had 3, 4 days, 5 days where I haven't done anything. And that's because I was busy with fellowship, or I had to take care of tasks, or I was on call, for example. So this is secondary to that. And for me, I've tried, as I said, this was just something I started as a hobby. It ended up into me discovering a passion for debunking misinformation, and here we are. But it really is just still the same process for me, kind of, that it was a year ago. I make a lot of my content, 90% of it, on the fly. I've tried a process where people will make videos, in advance, or they'll edit them, they'll do this, make sure they're ready. That process didn't work for me. I'll make it on the fly. And the beauty of TikTok is that all I need is maybe 10 minutes, or, to record a video, to edit it, and to make it ready to post. 10 minutes, all it takes, a minute-long video. Now, obviously, the background research, takes time. I'll read, Ankur, it's funny you say that. If I used to think that I did a lot of research with you, but with this over the last year, I have read so many papers, so many scientific communications, so many articles, and I'll read them whenever I have time. So, downtime between a case, for example, right? Just waiting for a patient to come in. I'll open up a paper and read the abstract to get ready, to prepare. Or Twitter, actually. Twitter is one of my main sources of information. I have a list of people that I follow. I'll just scroll through and see what's going on, and if there's something that I think should be put out to the public. And once I find it, the background research, what all of this is, it will take about a couple hours. This is all broken up over the course of the day. I have 5 minutes here, 10 minutes here, getting coffee, etc. And once I have everything ready, I'll just take out 5 minutes at the end of the day, after 5 p.m. and all my, or when all the cases are done and I don't have anything else going on for the day, or I'm on a different rotation, for example. That's all it takes, 10 minutes to make a video, and I push it out. So, on average, over the last year, I've put out, there have been days on the weekends that I have nothing going on. I'm not on call. I'm not at the hospital. I've put out 2-3 videos a day. And there have been days that I put out none, right? So on average, I say I have put out about 1 or 2 videos a day on average in the year that I have been doing this. And that is a level that is sustainable for me, and again, I want to emphasize that my job as a physician is primary. Everything else comes secondary. So do people that are looking to get into this, I think a couple of things. First of all, to me, as I said, my work as a physician, as a cardiology fellow, is primary. So this is all secondary to that. Second, it is something that you got to be passionate about. Are you passionate about it enough that you can keep going at it day after day, day after day, day after day, even though you are, even though it may seem like it's a worthless fight? Because I've had so many people tell me over the last year, why are you doing this? Nobody's going to listen to you. It doesn't matter. People are going to make their decisions. You can't convince them. So there's a lot of negativity, number one, that you see. There's also a lot of hate, and that comes in the form of what we call trolls on the internet that comment negative things just to comment. I have been called a variety of things: a government agent, a paid pharma shill, Pfizer agent. I've been asked innumerable times how much Pfizer pays me to talk about the vaccine, how much the government pays me to talk about the vaccine. I've been called a communist agent, a Chinese spy. I mean, you can just whatever you can think of. I have been called that. I've gotten horrific messages in my inbox, because the internet, you can be anonymous. You can say whatever you want. People have just been terrible, right? So you have to be, again, a lot of this is also because of what I do, right? So what I talk about the vaccine, which is highly controversial. People on either side of the issue feel very strongly. And a lot of the comments and the hate that I get is related to that. And that's not going to be for everybody. Somebody that just talks about cardiology stuff, for example, is not going to get this degree of hate. But I did. People have, I can go into it, but people have said horrific things. And, you have to be able to, that boils down to, you have to be able to handle criticism and handle negativity, and know what criticism is worth looking into and what criticism is worth, listening to, so you can improve yourself, and what criticism you can just throw in the garbage, right? And you have to just be able to keep going. If you don't have, a lot of this is if you have the passion, and as I said, I discovered this passion, right? I wasn't thinking about doing this. I just discovered it, and it was something that I ended up being able to do for a year, and I'll continue to do this. So I think a lot of it is also like, do you have the once you found the passion, and it's kind of like you with this podcast, right? You've been doing this for a couple of years now, at least. Being able to, like, what makes you want to just do episode after episode, find guests, and keep it going. So the persistence, the passion, I think is part of it. And the other thing is, you just all you need, this is the one thing that I love about TikTok. All you need is you just need to have something to say. That's it. You can download the app, make a profile, and it really is just as simple as that. Does that answer your question?
Yeah, no, it did. It actually did perfectly. And to answer your to the comment you made on the podcast, and this is season 4, so we finished 3 seasons, so this is its 4th year running. But you're right. Like, I think with anything that you give energy to, right, with anything that you give commitment to, consistency to, energy to, it flowers. The more you water, it flowers. So things you give energy to will grow. And I couldn't agree with you more that there has to be a deeper sense of purpose for you to be persistent and be consistent in putting out content. And that deeper purpose, for you could be the passion. I mean, for you is the passion for debunking misinformation, right? Or the deeper purpose is for the medical community to have an intermediary which the public can relate to, and that's a fantastic deeper purpose, right? I wish all of us have more of some of that in us, because we are in it for the public. For me, likewise, the podcast is through my nonprofit, which has a deeper purpose for me, and that is to have an impact on colleagues, and to sort of have a sense of community, and in doing that, meet like-minded people and grow, because each of these episodes have had an impact on me as a physician and a person also. So I think these are like for any one of us who's on any of these social media platforms, there's a deeper sense of purpose. And like with anything else, you'll get your share of criticism, and like you said, you have to be immune to it, but at the same time be very responsive to feedback.
One thing I forgot to mention, you mentioned deeper purpose, and that kind of, I don't think I emphasized it enough. You got to know why you're doing something, and for me, it's to, I am privileged enough, to have that knowledge, right? Have the knowledge. And for me, it was always, how can I help other people make the right decision to get vaccinated, or make the decision to get vaccinated, because it's their decision at the end of the day. And to me, it was just unacceptable. And it was a travesty, honestly, to me, that we were, and again, we share this as two people who are immigrants, right? That early on, it was just unimaginable that the United States is a country that made or at least played a major role in making the mRNA vaccines, right? Which are a miracle, honestly. The best vaccines out there. They had a major role in creating these vaccines. We had more vaccines than we knew what to do with. And there were people that didn't want to get them for whatever reason, right? They didn't want to get them because they didn't believe in it, or because they were misinformed. And to you and I, for where we are in the part of the world, this, like we would beg for vaccines like these, right? We would beg for basic public health measures that unfortunately don't exist in a lot of parts. Where you and I are from, Ankur, you're from India, I'm from Pakistan. So to me, it was just unimaginable that we were in a situation where, I used to read about states, I believe it was Kentucky, about in April or so, that they had to waste tens of thousands of vaccines because there weren't enough people to take them. So that, that to me was just a travesty. And that was one thing that drove me to make sure that I could do what I could do to help not solve, but at least make that problem a little bit better, because it was just unacceptable. What kept me going, honestly, was also the fact that throughout the year, I got so many messages from people thanking me, as I said, and also telling me that I am the reason that they chose to get the vaccine, or I am the reason that, they forwarded my videos to their family and their family chose to get vaccinated because they finally understood the one thing that they could not understand. Or, they had heard some misinformation from people that the vaccine was, that pregnant people weren't supposed to get the vaccine, for example, which we know is not true. So the messages that I got, and I still get them, that I'm the reason that people decided to get vaccinated, that's amazing. Like, to me, it was just, it put me on top of the world that I had a role in somebody making, I think, the right decision that, they, for themselves and for their family. So that is also honestly what kept me going, because I was like, okay, I got to keep doing this because there are still people out there that I can reach, and that my colleagues on social media that I do this with can reach. So I just wanted to add that little part as well.
Yeah, no, this, obviously it's excellent, and more power to you, and congratulations for all the great work you're doing. It's, it's public service and it's public health, and it comes, from your own time and amidst a busy fellowship, and there's got to be a deeper sense of purpose for you to be able to, like I said, be persistent and consistent and be immune to criticism and keep doing this. So,
I mean, I will say this. You asked me how I'm able to manage this. Honestly, I have my fellowship. I make time for exercise, and then I do this. That's it, really. And with the last couple of years, socializing has sort of been hard to do, as obviously. So it kind of worked out. I don't really have much else in my life, and I'm okay with that. I'm okay with that because to me, this is the right thing to do. So I work, I make time for myself, exercise. I'll maybe hang out with some friends here and there, and then I'll do this on the side, and that's pretty much. And I'm completely happy with that at this time.
Yeah, no, that's excellent. No, I think the bottom line message of carving out time for something like this, and because I get asked this question, from some of the nonprofit work that I do, including this podcast, is how do you make time? And the answer is that if there is a deeper sense of purpose, you will find time for what's important to you. And if this is something that's important to you, then you're going to find time for it. It's just as simple as that. So I'm gonna, with that comment, I'm gonna end the show. Any closing remarks for the podcast? And hopefully you can get to share this with your followers, and they can get to explore the why behind you doing the videos. Hopefully that gets the answers to some of the questions that they've been asking you or have been wanting to ask you. But any closing remarks for the podcast?
No, Ankur, thank you again. I didn't even realize we were 45 minutes in, such a great conversation. But I appreciate you bringing me on and, talking about something that's important to me. And I think something that should be important to everybody. And one thing I will like to say is, I get asked this quite a bit. I think that, and I didn't mention this, physicians should consider, and the social media, a lot of physicians have shunned social media. Oh, it's just a fad. TikTok is just for dances. Instagram, I don't need it. It has no place in medicine. That kind of thought and thinking is very outdated. And the fact is that social media is not the future. It is the present. It is here. And the reality is that, TikTok, which has been dismissed by many as, oh, it's just an application for dances. That is completely not true. TikTok and Instagram and Facebook are the major, if not the only, source of news for the general public. That's how people get their news. That's how people get their news on current affairs, on politics, on medicine especially. And I think it's about time that physicians realize and healthcare workers realize that this is what's happening. Because if we don't, we need to tap into this. And I'm not saying everybody needs to do TikTok, but if you don't realize this and if you don't tap into this as a way of connecting with our patients, I think we're doing a great disservice to them, because this is the way that they get their information. And you got to go where the people are, and the people are on social media, on TikTok. And that is a great, I think people need to realize that more as well. But thank you, Ankur, for having me again. I really am honored to be here.
Yeah, no, great messages, and just a great message to end the show. And I agree with you. Social media is here to stay, whether you like it or not. It's the present, and quite frankly, it has changed governments and toppled leaders. So if people don't realize its power now, then I'm not sure when they will. But we're going to end on that note. Siyab, thank you again for being a guest on the show at Parallax, and for doing all the work that you're doing with your public health service on TikTok. And more power to you, and we'll talk soon.
Thank you, Ankur. I appreciate it. Take care.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app, or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/parallax. Thanks for listening.